welcome in. Let me have you take a seat. We'll get you back in the room shortly.
Thank you.
I've been in pain for about 4 to 5 years now, and it started off in my lower back, like my pelvic bone area, and gradually over time it would like shoot up my spine, up my neck, and then since my body just didn't know where the pain was, it started going to every other joint in my body, so like my ankles, knees, wrists, shoulder blades, and eventually it started affecting my skull. Like it just hit every major bone in my body.
And you kind of need your body because you're a really active person. I mean, you play soccer in college, but you were in a lot of pain.
Yeah, I play soccer at University of Mary Hardin Baylor. It's in Belton, Texas, and I absolutely love it. But last year especially, I had to sit out and like not practice or anything for a good 2-3 months because it was just so much pressure on me, and I definitely had to think about my health and if I had to quit soccer in order to do that, which I didn't want to do, but if that's what I had to do to help maintain my health, I would have done it.
Constance came into our clinic, and as I was going through our detailed history that we go through with all of our patients, she described overall bone aches. She described overall general malaise, which that just means that just achiness all over, and she's been to every other doctor that you can think of.
How quickly were they able to diagnose you?
A week to figure it out, which was very shocking to me because I was going to doctors for 7 months at that point. But he did like 4 or 5 physical tests on me, and he took x-rays, and then the next week I came in and he already like knew what was wrong.
I could tell that her pelvis was shifted. So when we do an exam, we check to look to see if the ears are level, if the shoulders are level, or the hips are level. Already at that point I knew that there was a shift or that there was an issue with that leg length discrepancy.
It seems like the smallest thing was wrong, and it was all because of just one little 5 millimeter difference in the length of your leg.
My right leg is 5 millimeters shorter than my left leg, and it was just causing everything else in my body to be in so much pain.
What is leg length discrepancy?
Yeah, so that's where the right leg and the left leg don't match, right? So it could be the femur's longer on one side and shorter on the other, or it could be a combination of your tibia, the lower legs, also not being balanced. So we measure the top of the femurs, the bottom of the femur, see if that's the same length, and then we go from tibia to tibia as well.
A lot of chiropractors will only look at x-rays for pathology, so if they have cancer or tumors or anything broken. But you'll see on this x-ray, we take a lot of measurements, and the measurements are key to determining if the patient possibly has a leg length discrepancy. So from this x-ray, you can see all the measurements we took, and from the naked eye, you can't just look at that x-ray and know that she's shorter on one side and that her pelvis has twisted, but if we look at the actual measurements, we can see that she has a 7 millimeter difference here on this right side. It's lower, and then this line should be going right through the middle of the pelvis, and you can see she's way off here to one side. Using that information, I'm able to determine which way we're going to adjust her. We take a very specific x-ray that takes a shot of the hip, the knee, and the ankle all in one shot with a special ruler that's behind it, and so we can get down to the millimeter to know exactly how far off the legs are.
It's amazing that something so small, like a few millimeters off, can really cause so much discomfort for people.
Yeah, 3 or more millimeters can actually make a big difference, and that's a very easy fix. It's a very easy fix to put something in their shoe and just balance it out.
Whenever he told me that, I was like, that's it.
So the heel lift, how does that work?
It basically, the heel lift is exactly 5 millimeters, and it basically balances out my unalignment.
This isn't something that's commonly taught in chiropractic school or anything like that?
No, it's not. In fact, we're taught that anatomical differences are very rare. They say less than 3%. In our x-rays, we're finding that it's more common, it's more closer to like 75% of the time people have issues with that. The problem is that it's not looked for every time, and it's also how it's measured. Very often it's measured simply with a tape measure. And so with the x-ray, it's very objective. We know exactly, and we got it down to the millimeter. There's no room for error. We got it down.
And this all started because Dr. Natalie Cordova was finding her adjustments just weren't sticking, and that all came down to leg length discrepancy for her.
Right. Everything in our office is stuff that we try like ourselves.
It affected my right leg only, and it made my leg go numb every time I cycled. So I ended up seeing a chiropractor, and I got good results. But it still kept coming back. After doing the research that we did, and we learned about the leg length discrepancy and how to accurately analyze it in x-rays, we were able to determine, no, I have a 7mm right short leg. And so by balancing that out with a little wedge, put that in my shoe, you don't even know it's there. Now I'm balanced and it's been stable.
A lot of patients will notice like they feel like one of their legs is shorter than the other, but they've not been able to get that verified, or somebody said, oh, you're fine, that's not something that happens. And so we just check it objectively to make sure.
And then you're making it really easy for people to come and check it with you. Absolutely,
100%. We want to make sure it's as easy to come see a chiropractor and get the full evaluation. So our special for Houston Life viewers is $37. They can get a consultation, examination, and x-rays to find out if they likely have a leg length difference, and then we can go from there. We've had people come in because of Houston Life and see those things, and that made such a big difference for them. So.
It feels great. I've noticed a difference like almost immediately because I've noticed that I'm walking more straight, which was funny to me. And then I've also noticed in soccer, I feel like I have more power to run, more power to dribble, just more power to do anything while I'm playing. Last week when I was here, the lady at the front desk was telling me that everyone in the office was just very impressed with me because I'm in school right now, and for 2 weeks I drove back 3 times a week to come get adjustments. So it was like 16 hours of driving for like 2 weeks. Because I wanted to come because I was like, this is the only place I've been that has actually made me feel better. And I love it here. It's very, very welcoming.
All right, Core Chiropractic has 2 locations in Houston, one in the Galleria area and one in Greenway Plaza. And as Dr. Cordova mentioned, they do have a special offer for Houston Life viewers.
Yeah, new patients get a consultation, an exam, an x-ray, first treatment, and copy of Dr. Natalie and Dr. Philip Cordova's book, Better Posture Fast, all for just $37.
And you can find out more info online, corechiropractic.net/HoustonLife, or you can call 713-622-3300.